Sciatica. It's a common term that we're all familiar with, and we all recognise that it links to low back pain. And low back pain is something that around 80% of the UK population are going to have to deal with at some point. So we really want to help you understand what it is and what it is not. Most of the time, back pain is a normal process. It's just your brain letting you know that you've either done too much as a bit of a warning sign, you've strained a muscle, which is only going to get stronger later, or you may have done something more serious, which is what we want to discuss. Truly, sciatica is an inflammation and irritation of the sciatic nerve. And the sciatic nerve runs from the base of our low back right the way down the back of the leg into the foot. So traditionally, this is seen as a sharp shooting pain, which is known as radicular pain, that goes down the back of the leg. Typically made worse when flexing or bending forwards, putting your shoes and socks on, and activities such as this. Most of the time, this is caused by a herniation of an intervertebral disc in the low back. Many people refer to this as a slip disc, which frankly is not true and is impossible. Instead, what happens is, as a natural process over time, the fluid filling inside our disc can work its way to the outside and bulge. And that bulge could irritate the sciatic nerve. If it does, most of the pain is actually caused by inflammation, not the structural movement of the disc. Because some parts of the disc are quite unique and that they're seen as foreign to our body. So it's as if the brain thinks there's a foreign invader, a pathogen, almost like as if you had a bacteria. So it creates a huge immune response and a massive inflammation that causes the majority of the pain. Sometimes this can take between 6 to 12 months to fully heal. And once it's fully healed, we then revert back to our 5-step process to help desensitize that tissue now the healing is done. The question is, what can you do in that period whilst it's healing? And that disc, in most cases, will actually resorb back to its original position. It's all about typical pain management, maintaining a good quality of movement, managing your hydration, and trying to not avoid moving in fear of pain. So hopefully that gives you a little bit of a better understanding about sciatica, and we'll have some more videos explaining this in more detail.